most people have a family health history of at least one chronic disease. We're talking like cancer, heart disease, diabetes. If you have a close family member with a chronic disease, it then increases the likelihood that you could develop the disease as well. As families come together for the holidays, it really is a good time to talk about more than just what's on the table. It's a chance to talk about family health history as well. Well, to get us talking about how to even start these conversations and why they're so important is Dr. Chad Haldeman-Englert. He's with Cone Health Precision Health. All right, so let's talk about this. Knowing our family history is important. Some people might think, okay, I can't change it, so why am I asking about it?
Yeah, so it turns out that the conditions that we tend to have usually are due to a combination of the things that we inherit from like our parents. But it turns out that there's also other influences that can affect how those conditions happen. And so even though you might be someone who might have a family history of something like heart disease or cancer, or diabetes, you can actually do some things that can actually try and make those conditions occur less frequently.
We're talking about eating better, maybe exercising, those kinds of things, right?
Sleep, yep, exactly. All of
Okay,
that.
so let's talk about how far back we should be looking in our family tree and who we should be including.
So if someone were to come see us in one of our genetics clinics, so we're a group of genetics providers, of physicians and genetic counselors, and when we tend to see people in our clinic, what we often do is we generate what's called a pedigree. And so that is especially a 3-generation pedigree at least. And so that's the individual that's coming to see us, plus any of their siblings, kind of on that generational level. But then we want to know about their parents and maybe their siblings on that generational level, and maybe even go one higher up to the grandparents. And so that's what we call kind of 3 generations. And you'll see us draw if you ever come to see us in clinic. We have circles and squares and lines connecting everything. And so that's what we call that family tree. And of course, if you have children, then that would be another important thing to add to that as well.
Gotcha. Okay, so let's talk about the information we should ask about. And is it just about who had what, or do we need to know specifics like the age they were diagnosed, or if the what happened when the heart attack happened, that kind of stuff?
Yeah, it turns out that the earlier that something occurs in an individual might make it a little bit more important for you to know about. So for instance, someone who has cancer before the age of 50, whether it be breast cancer or colon cancer, things like that, or heart attacks like at a younger age, that younger age is actually a really important thing to think about. Another thing is rare kinds of disorders. So that would be like, let's say you have a rare type of cancer, or someone in your family that has what we call a rare condition. Those are things to also pay attention to as well, because when you see something occur earlier or something that seems a little bit more on the rare side, that might increase the chance that there actually is something genetic going on that caused that to happen in that person.
Okay, I understood. So when people think of family health history, many tend to think about things like what we talked about, cancer, heart disease, diabetes, but what other aspects of health history would also be really important to know?
I tend to think about things in the category of like dementia. I kind of like, what are some of the top things that are conditions that affect people in the United States? And dementia is one that's really high. Chronic kidney disease is one that's really high. And so conditions like that, I would also consider adding to the mix, just because that's stuff that can run through the families that can increase a person's risk for things like that as well. So I would kind of look at the things that tend to be common things that people tend to go to the doctors for, and that would be the sort of stuff that you would want to think about.
Okay, now I want you to talk about like what happens once we know this information, how that could impact like our healthcare kind of decisions going forward, tests and things like that.
So if you are determined to have, like, let's say you know that there's something genetic in your family, then one of the things to think about is actually yourself getting tested to see if that's something that you inherited or that you may also have. If you do actually carry something that runs in the family, then that definitely could have implications on when you might want to get testing or screening performed, especially for things like breast cancer, colon cancer. Those sorts of things you would want to start at an earlier age than what's typically recommended for just the general population. And so you could base some of that information on your family history, but if there's certainly something known in the family in regards to a genetic condition and you get tested for that, then I would recommend that you follow whatever those types of guidelines are related to what you were tested for. for, and if that were to turn out to be positive.
Okay, and so you talked about family health history, you talked about genetics. When should someone consider actually getting some kind of genetic testing or things of that nature?
Certainly, if it's known in the family that there is a genetic condition, that is definitely one thing to think about. And again, we have, you could see a genetics provider that could be like a genetic counselor or geneticist that could talk with you about what are your options for testing, what are the chances that you could potentially have something. The information could be very helpful, obviously, in regards to your health and what types of then treatment you would want to do based on what that testing would show.
All right, and I think you use this word, and I don't know if I'm going to say it correctly again, genomics? Genomics? Genomics,
Yeah.
okay, genomics. So explain what that is with regards to our personal health journey.
So genomics is, I sort of think about it that it's basically the genes that are in, so our bodies are made up of thousands or actually trillions of cells. And inside of those cells is our DNA, and the DNA makes up our genes. And those genes are the things that are important for telling our bodies how we should function. So basically how we grow, how we develop, what the body should do. And so it turns out that we all carry differences to our genes. The question is are those differences ones that could really impact our health, or are they just something that's kind of benign and we don't really have to worry about it? The majority is in that second category. However, some conditions or genetic changes could actually have really significant impacts on our health. And so you would definitely want to say, all right, then if I have a genetic condition like this, then that could certainly impact that. We have at Cone Health, we have a new department that just started called a Precision Health Department. And we're working on kind of having all of our genetic services sort of be expanded to what kind of Cone has already had. And the idea is that we can provide education, we can see patients, and then we also have a program where people can get a free genetic test that's called Gene Connect, where someone could actually identify that maybe they have a genetic change that they didn't even know that they had. And so that's some things that we're trying to do to basically say, maybe it's important to think about these genes because they could be certainly very important to your health.
Right, and I like the idea of the free test so that we can all figure out if we really need that or not and what our next steps are. We're going to take a quick break. We're going to continue to talk about this, especially how to start the conversation at the table. That's coming up next.